Yeah, hi, I'm Dr. Madawi, neurosurgery. I will demonstrate for you today two techniques of suturing, the interrupted sutures and the continuous sutures with lock. And come with me. This is my twin sister, Sue.
Hi, Sue.
Yeah, we were born in the same day. Okay,
Okay.
let's go there. But one in America and one in Egypt. Okay.
Same mother, that's amazing.
Yeah. Okay, so now as I was saying, the best way to start your suturing technique is to hold the needle holder, with the needle holder perpendicular like that, and 1/3, 2/3 with the sharp end. So 2/3 at the sharp end side, 1/3 at the other side, perpendicular. So it won't be angled like this or like that, always perpendicular, and always hold it with the end of the tip of the needle holder, not there but at the end of the needle holder. Click it, and then you hold it not from those rings, finger rings, from here. It's easier to handle the needle holder if you hold it from here than from there. So if you are holding it like that, you will have to bend your wrist, where if you hold it from here, you can control it better. Okay, so let's say this is the one. This is just the practicing board, of course. Those are just material we use. Start with the bite. You always start with buccal. So if this is the oral cavity, this will be the buccal side, and this will be the lingual side. You always start from the buccal side. Take a good bite, not small bite. Good bite. Let's say at least 3 millimeters. Here is more, but just for demonstration. But usually it's 3-4 millimeters. Bite of tissue means that the distance from the edge of the wound to where you insert your needle. This is, we call it the bite. And this is the bite. Then release. Do you have any questions?
I have a
Stefan?
question, yeah. So obviously, if you take too small of a bite, you'll tear.
Mm-hmm.
The suture won't hold. What's the disadvantage to taking too large of a bite?
No disadvantage.
Okay.
Unless the tissue, the buccal tissue, are very loose. Like, you don't try to take it from way below, and like the bite will include some of the loose alveolar mucosa. Then the alveolar mucosa will be wrinkled, will be pushed or pulled toward the knot,
Okay.
and will be wrinkled. So I would say maximum 5 millimeters.
Okay. Great.
Then, as I was showing here, once you took the bite, you unclick or release the needle holder, not by pushing it away, like upward like this, but pushing them away in this direction. So you're not pushing up, just pushing them apart like this. Now we release the needle. Grab the needle from there, take it out, rearrange it the same way again, 1/3, 2/3. Hold it from here, click again, and hold it back there, and then take the lingual bite, like that, and take it out. Now pull, 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 until we have that much length of the suture on the buccal side, and now the needle is outside the oral cavity, and I can put it down like this. Usually the patient has a bep on his chest or her chest, and it's clean. You can lay this on the patient's chest and come close to the wound area inside the oral cavity. Now we are having that much of the suture on this side, and now to make a knot for this suturing, we start with always towards the free end. This is the free end. So you start turning the suture 1, 2 toward the free end, not away. So towards the free end, 1, 2. Grab it from the end. Don't grab it from the middle here. It may tangle. So we grab it from the end, like that. Click again. Slide the needle holder in your hand. Bring your fingers close inside the oral cavity, close to the wound, and make either like that or with 2 thumbs. Usually you need the index finger from one hand and the thumb from the other hand, like that. Now we have tight knot. but it's not enough. We need to stabilize the knot by taking 2 more knots. The first one, we did 2 turns. The second one will be only 1 turn and on the reverse direction. Click, slide your fingers close, and make the knot. Then 1 more. Click, and that's it. And then you hold them for your assistant close to each other. Don't hold them like this. Still hold the needle holder in one hand and the suture in the other hand, and bring them close, and then your assistant will cut like that. Okay? Now this is the interrupted suture in slow motion. We can do it a little bit faster. Would you like to do it faster? Or?
Sure.
Okay. So faster, a little bit faster. You go 1 bite, take it out. I can take the 2 bites in 1 pass, but it's always better to take the 2 bites in 2 passes. Especially in the oral cavity, you always have this gap between the 2 sides of the wound, the socket space. So it's better to take them in 2 passes. Take the bite from the other side here. One, 2, grab it, and then 1, and then 1. Hold it, cut. So this is the interrupted suture. There is another technique when we do the pre-prosthetic surgery, like removing of buccal bony undercuts or alveoloplasty or tori removal. So we made the incision on top of the alveolar ridge, and then so we have already very approximated edges of the wound. We just need to make tight sutures, continuous. We call it continuous with lock. We start with the first one. Always start from the most distal part of the incision and move forward. So we start with the first one. Let's take the 2 bites in 1 pass now. It's like the same regular interrupted suture, like just we did. 1, 2, hold it, go there, and make the knot, tight knot, like that, and then reverse direction, hold it. This is the second knot, and the third one, like that. Now we don't cut both ends together, we cut only the short end teeth. Now I still have the needle, attach it to the needle holder, to the needle, to the suture. Now I take the second suture, less than about, let's say 1 centimeter apart, more mesial. So take the 2 bites again in 1 pass, grab it from here. Now I have this loop of the suture formed between the first and the second sutures. Most of the time you just need to pass the needle through the loop and then pull, but I always like to give this 1 twist to make it more stable, the knot more stable, and then pass it from inside, outside, and then pull. When I pull like this, I will have the continuous suture with what we call it the lock. So continuous suture with lock, and then take as many as needed until I finish suturing the whole incision. The loop, twist, pass it from inside, outside, and pull. And always keep the knot on the buccal side. Always the knot on the buccal side. Let's see.
Why is that again?
Less irritating to the tongue.
Okay.
And more visible to you.
When you.
If you need to remove the suture.
Okay.
When we use the chromic suture, we don't need to remove them. They resorb on their own. But when we use the other kind of sutures like silk or Vicryl, we may need to do that. Again, 1 twist, pass it inside, and pull. Now, this is the last one. Let's say this is the last suture. Now we need to make the final knot. Now, I wouldn't pass it now through the loop. I just keep the loop as if it is the single end. Make 1, 2 turns, hold it from here, and then click, and then tie. This is the final one. Now we have the continuous suture with the lock. Now you cut both. Would you like to try this on your own now, guys?
Yeah. Thank you so much, Dr. Madari.
Thank you.